What is the role of a Medicare supplement policy, also known as a medigap plan? People are always getting this confused, so I want to give you some clarity. A Medicare supplement policy is actually a secondary payer to Medicare. So what I mean by that is that when you're on Medicare, if you stick with original Medicare, your insurer is the Centers for Medicare and Medicaid Services, the federal government program, Medicare, not the Medicare supplement policy. So here's how it goes. Let's say you get an MRI, and your doctor or the company that gave you the service, they're going to bill CMS. It is not your Medicare supplement policy that processes the claim or receives the bill. It's CMS. So CMS receives the bill, they process, they approve, they determine how much they're paying, and once they've met their obligation, they're going to send the balance of that bill to your secondary payer, to your Medicare supplement policy. At that point, when they receive it, the supplement company, their only job is to pay it. Next big thing people worry about and often get confused about is should they go with Medicare Supplement Plan G or Medicare Supplement Plan N? Based on what I just explained to you, remember that it's not approved because you're in G or N. By the time it gets to the supplement company, it's already been approved. But what happens with G versus N is that has an impact on how much you contribute to the cost of the claim. If you remember, Medicare is not designed to cover every dollar. So after Medicare pays its portion and the balance is sent to the supplement company, how much you pay is going to be dependent on which plan you're in. We know with Plan G that you've already met your Part B deductible by the time Medicare starts paying, and G is going to cover 100% of the remaining 20% on a Part B claim. When it comes to N, they're going to cover 100% of that 20% minus a small copay. So when you're choosing, G or N doesn't make it approved or not approved. Again, it just impacts how much you pay, but when you take G, you pay more up front. With N, you pay less up front, but you have cost share. So that's it. Actually, one more thing. People are always worried from carrier to carrier. Let's say they're looking at Plan G, which plan to take, which company to go with. Remember this, Medicare supplement plans are standardized by law. So what does that mean? No matter which carrier you go to, they're going to offer you identical coverage for that plan letter. And it makes sense. Think about it, because their boss, Medicare, has already determined what's owed. So no matter who the carrier is that it gets sent to, the balance, the amount due is already decided. And that's because it's standardized. It's that 20% remaining for Part B.